Okay, so what do you need to know about endometriosis? Firstly, it is a super common cause of chronic pelvic pain. And secondly, women suffer for years and years and years before diagnosis is made because they're often just told that these debilitating period cramps are normal. They are not normal. So let's look at the pathophysiology of why it is so incredibly painful. So here we have the uterus, tubes, and ovaries, obviously. This is your endometrium. For reasons that are very poorly understood, but the way that I like to explain to patients that makes sense to me is that for some reason, instead of the endometrial tissue coming out the vagina the way it should, sometimes it can track up the tubes and end up on the ovary, or in fact anywhere else in the pelvis, on the broad ligament, on the bowel, on the rectovaginal septum, literally anywhere, and sometimes even far more distantly in the body. But the commonest site is the ovary. So why is it so painful? So the dysmenorrhea is caused by the fact that all of these other endometrial deposits are still under the governance of the monthly hormonal cycle. So as the endometrium inside the uterus is thickening and thickening in preparation for implantation, all these other deposits are getting bigger and bigger, and they distend to such an extent that they can irritate the peritoneum or stretch the peritoneum, which it's not designed for. They can squash and compress other organs, but the main issue is that you've got this distending tissue that's in a place where it's not meant to be. So the body responds to this as a foreign body, and it mounts an inflammatory response. And if this isn't managed, then after a while, that inflammatory response starts causing adhesions, okay, scar tissue. So here are little adhesions. They can stick to each other, they can stick to the bowel, they can stick to the pelvic side wall. And then what happens is that these adhesions start causing distortion of the anatomy. So you get distorted tubes, you can get uterus stuck to bowel or pelvic side wall, and the whole pelvis can just become essentially destroyed, anatomically speaking. So once these adhesions have formed, a woman might still have that very clear pattern of severe dysmenorrhea related to periods, but she's going to have pain at other times outside of her periods as well, because these things are now stuck together. So whenever she moves, something's going to pull, and she's going to have this constant pain. So that is endometriosis. Those are the deposits that happen outside the uterus, in other places in the pelvis. Now let's look at what adenomyosis is. Okay, we're going to clear all of this tissue away. Adenomyosis is what happens when the endometrial tissue burrows into the wall of the uterus. Okay. Now, again, you're not supposed to have endometrial tissue within the myometrium. So again, these deposits are going to get fatter and fatter and fatter and distend as the cycle continues. And that's where that agonizing pain comes from. And secondly, these deposits of endometrium are still in communication with the endometrial cavity. So whenever the endometrium is being shed, these deposits are also going to be shed. So that amounts to a massive increased surface area of endometrium that is being lost, which is why in adenomyosis, that's why Misa was bleeding, adenomyosis causes heavier periods. It's more common after childbirth, so there's some theories about how the placenta might disrupt the myometrial endometrial junction. So yeah, postpartum this might manifest for the first time. And all of these little deposits that are burrowing in here will cause the uterus to enlarge. So that is something that will be palpable when you examine the patient. Okay, next stop, we are going to move on to what particular things to focus on in history and what the likely examination findings are going to be. And just to add that chronic PID, which is yet another common cause of chronic pelvic pain, the main mechanism for that is adhesions. So when you have an inflammatory response in the tubes that can spill out into the pelvis and cause adhesions and things to get stuck down to each other, that's the most likely reason that chronic PID causes chronic pelvic pain. Okay, stay tuned for history, examination, and management. And let me see.